an alumni of the 1,000-hour program here at the Santa Barbara Body Therapy Institute. I began my studies of massage therapy, Qigong, and lymphatic drainage back in 1995, and since then have continued to have practice in Santa Barbara, Los Angeles, and now in Phoenix, Arizona. Lymphatic drainage, which is the class today, we are focusing on the lymphatic system, which is basically the body's sewage system. It's what takes all the toxins that are developed through normal metabolism, as well as the toxins that we gather from the environment, from our food, from the air, from water, from the electromagnetics, and any heavy metals that we're exposed to through pesticides or dentistry. And it tries to pull those toxins out of the tissues and break them down so that they can be purged out of the body. The lymphatic drainage is designed to increase that flow, allow the body to have an easier time detoxifying and breaking down those toxins, and assist in eliminating them via the skin and the large intestine primarily. With the manual lymphatic drainage, we use a light, even flowing touch to go with the rhythm of the lymphatic system, squeezing along those pathways to circulate that lymph through what we call lymph nodes, which are basically the recycling centers. They take all these toxins and they break them down into smaller and less toxic pieces so that they can be reassimilated in the body, the parts that are useful, or to eliminate the parts that are still toxic. Lymphatic drainage can be useful for general health, but it's also very useful for people with serious debilitating illness, especially those people who are inactive, such as on bed rest, disabled, or elderly. It's important with the lymphatic drainage to begin by opening up the elimination pathways. The main pathway of elimination for the lymph is through the large intestine. So we'll begin just by circling the large intestine, increasing the flow of elimination of toxins out of the body. The lymph nodes, which process the lymph, are in greatest concentration in the joints of the body and in the abdomen. So that's going to be a primary focus in the treatment. Begin after draining the belly by coming in and draining the legs and the feet all the way up to the inguinal groove, which is the hip flexor groove. The lymphatic drainage movements are done in a slow, rhythmic motion, often applied with oil. Begin with the slow, even pressure with just a gentle squeeze. You want to get a sensation of fluid moving in front of our hands, and we want to kind of squeeze the whole leg like we're trying to empty out a tube of toothpaste. And then just a gentle glide back down, not worrying about the flow of the movement, because lymph only moves towards the heart. This V pattern of the hands is the primary technique, and we can do it here on the anterior side of the leg. We can also come and do it on the medial aspect of the leg. And you don't necessarily have to squeeze the whole leg at one time. I can do the lower leg and then come up and do the upper part of the leg. Now when we're coming towards the groin, we turn the hands in so that we're not invading anyone's privacy. back down just to keep an even flow of the movement, give it a more rhythmic pattern. And then the other technique is milking. So we're going to just kind of gently coax and milk the lymph. It's especially useful around the joints and the bony areas and around the neck, face, and throat. So it's an excellent way to help drain water on the knee, which is an edema, or fluid collection on the in and around the knee. And it's also for the ankle excellent for relieving the swelling of sprained ankle. And after we do the little bit of milking, we do another drain.